excited about this presentation. You know, falling can happen at any age. Actually, they talk about even small children falling and pulling things down. So I didn't exactly advertise it that way. I just, you know, wanted people to come about fall prevention. So I'm one of the parish nurses here, and we provide these education opportunities. And if you have any suggestions after you're done today, you're welcome to let me know, and then we can see if we can get some speaker and to come talk about a topic you're interested in. Out there, I need you to sign in. I think most of you signed in. There's handouts on that table. You're welcome to take any of the handouts. They're available. There's DVDs. The Go for Life DVD is by Area Agency on Aging, and it has exercises. I started watching the first one, and it has a squeeze ball, and it has other things. So it's about 50 minutes of exercising. So how today is going to work is we're going to have Ilse, I'll introduce her in a second. She's going to speak about fall prevention. She's an occupational therapist. And then I actually have a video that I participated in called Fit and Fall Proof, and we're going to do some exercises. That's why I've left this area a bit open so that we can actually do some exercising. And I have bands to give out to you too, TheraBands, so you can take home. So part of strength training is the important piece that we prevent falls. So you got to keep your body strong, and I have some bands cut up for you that you can work on. So we'll get started with a word of prayer, and then I'll introduce Ilse, and we'll get going. Dear Heavenly Father, we just thank you for this beautiful day. We thank you for the sunshine that you give after all the moisture we've had. We thank you that the spring is coming, and the beauty and the sounds of the birds, and you have blessed us greatly. We just ask you to be with us today and watch over us, and we thank you for the opportunity to praise you and all that we do. We ask all in your Son's name. Amen. Okay, this is Ilse. Her maiden name was Coleman, that's how I knew her. But she's Clausen because she got married a month ago. She's an occupational therapist at Pocatello Medical Center, and she kindly offered to do this, and this is a great topic for us to work on. Occupational therapy, it's Occupational Therapy Month. Who knew? I just had a little note, so she can tell you what that means. I've had occupational therapists work with me after my knee surgery, and they were wonderful. They really help you learn how to adapt and accommodate you for your lifelong skills that you need to do. So I can't think of anything else, but she can introduce. She can introduce.
Thank you so much for having me.
I'll let you go ahead.
Thank you everyone for coming. I'm really excited to be here. So I am really interested in fall prevention because in my 2 years at Pocatello Medical Center, I think in one day, if I have 13 patients, 8 of them are fall related. And I remember in my education, my professors just pushing fall education, staying active, and I just was like, they bring it up all the time. And I really understand that now because a lot of the people we're seeing at the hospital are coming in related to a fall. So I'm excited to kind of give you guys some tips and tools to decrease your risk of falling, okay? So a little background on me is I work at Pocatello primarily. I also work at Quadruped Meadows Rehabilitation Center. And I work with all the patients in the hospital. So if you fall, you're probably going to see me, but you're not going to fall after today, right? So, hopefully, right? We're going to work on making our plan to decrease our risk. So, just by a raise of hands, do you guys know someone who's fallen, or you don't have to disclose if you've fallen yourself? Okay. Yep. So it's
less than 7 months.
Oh goodness. Okay. So it happens quite a bit, and it can turn pretty into a big medical event very quickly, depending on where you are and everything going on. So, as you all see, it's a really big health concern. So once you start falling, that makes your everyday activities a little bit harder, and then that fear starts to grow, and then we start backing off from doing the things we love because we don't want to fall. And that's just the way our brain works, but really all that's kind of making us a higher risk of falling because we're getting weaker and we're not stretching our muscles and using our muscles as we normally would to get up and down and move around. So know, and maybe you don't know, falls are the leading cause of death in people over 65 years of age. Sometimes they are because you fell because you're having a cardiac event or something going on, but the fall ultimately may lead to mortality, unfortunately. So I'm in the right step by getting here together to talk about some resources we can use to decrease your risk. So with that being said, this here, I forgot to click. So that's me, and I work primarily in the hospital. I also work in the rehab and then Equinotos. The goals for today is we want to recognize that most of the falls among older adults result from interacting risk factors. So we'll go through those together. There's a sheet out there that I can come bring out that has these listed too for you, okay? And then I'm going to describe how an OT can help you if you ever fall or if you already have had some falls and want to look at some ways to decrease them. And then identify some strategies and resources that you can use to reduce your risk of falling. We're going to practice how to help someone get up after a fall, and then also practice some ways that you can help yourself get up and go through what to do after a fall. Because obviously we don't want you to move if you're hurt, but we'll go through some procedures that you can do to minimize your injury and the time that you're on the floor and those types of things. Okay? So why do falls happen? Any thoughts? Some people were talking about it.
They're just trying to hurry too fast and being careless.
Right.
That's what mine was.
Yep. So that is usually what it is. Actually, yesterday I was working. I have a patient who is about 80 years old, living independently, and was taking towels out of her shower, and the phone rang. She turned and something was under her. She slipped, fell into the tub, and she was in there for a little while. Thankfully, she had her cell phone, but she did break her spine in quite a few places. And she had already fallen a month before and broke her elbow, and they fixed it, but then she re-broke her elbow. And I asked her, she's the sweetest person in the whole wide world. And I was like, so I'm teaching this class, what advice do you have? And she's like, do everything you can to not fall. Because now she's got, it's called a thoracic lumbar sacral. It's just a fancy word for this big brace that she has to wear with a neck component. And, you know, thankfully she didn't have a spinal cord injury, but that can happen. So it's really important to try to not get ahead of ourselves, but yes, get in a hurry. Sometimes it can be an indicator of a health event. You might be having a cardiac arrhythmia, your electrolytes might be off. If you've got a chronic illness like diabetes, multiple sclerosis, just some examples, there might be an exacerbation of that illness that's causing a fall. If you've got a change in medication, that can cause a fall. Just age-related changes with your vision, your balance, any of those muscle strength, those are all changes. So these can all just lead to some accidents happening, okay? So that's why falls happen. I read a lot of research on falls because most of my patients are in the hospital because of falls. And all it's pointing to is, you know, we're not going to completely, like, life just happens. There's some risk factors we can't control, but some risk factors we can be aware of and decrease our risk. And that's what our goal is, to make our own personal plan. And you guys are the leaders of that. Your family and I can come tell you some things to do, but you've got to think about what's a risk for you and how can we decrease that risk. So 3 risk factors. There's physical risk factors. And that's an example of that is in your home if you've got no space to walk around. There's big furniture, there are throw rugs that you've already tripped on, there's electrical cords, let's say you need to start using a cane and you don't have enough room for your cane. Those are just some examples of some physical things. In addition to that, the bathroom, and I'll kind of go through the bathroom a lot. The majority of falls happen when you get up in the middle of the night to get to the bathroom. a lot of us females, after having kids, we have urgency and incontinence and we just don't have enough time and we get in a hurry and fall. Or when we're getting out of the shower, that's typically where they happen. So we want to make sure our bathrooms are set up with handles and those types of things. Then there's behavioral risk factors like we talked about, the getting in a hurry, not planning ahead if we know that when we first get up our balance isn't 100% and we don't account for that in our daily routine, or using poor body mechanics, twisting instead of turning to reach for things, or bending at our knees instead of, we want to bend at our knees and we do this kind of a thing. Those are all things that are behavioral changes we can make. And then environmental risk factors, uneven surfaces. You guys remember the entrance, the sidewalk? Every time I saw it, I was like, oh man.
That was me.
Did you fall on that?
Yes, I did.
Oh no, I'm so sorry.
But I had just come from my Zumba class here.
Okay.
So I was all limbered up. I mean, my ankle was kind of angry at me for a while, but
Okay,
yeah.
you're better now?
Yes,
Good.
yes.
And it's interesting how it's already shifted back.
Mm-hmm.
And my husband's a civil engineer, so he's always telling me the math behind that. And I'm like, well, I'm just glad it's even. I'm like, good. Okay, so those are just the gist of the risk factors. So how can an OT help you? So a lot of the times I joke with my patients because they're like, I don't need a job, I'm retired. And I'm like, I won't be helping you find a job today. Occupations to us are activities you do all day. The things you need to do, the things you have to do, and you want to do. The basics are your self-cares, getting dressed, in and out of bed, in and out of the shower, cooking, cleaning, driving, etc. So we look at all those things you need to do and provide information on how to do that safely. So for you guys, if you wanted an OT to come to your home or give you some education on fall prevention, we just look at your routine and how we can make things safer for you. In the hospital, my patients can't get out of bed, they can't get to the sink to brush their teeth on their own, they can't get to the bathroom. So those are the things we work on there. So it just really depends on your situation and what you need to do, and we start helping you become independent again. So we help people of all ages. A lot like Deb said, a lot of people think fall prevention is just for older adults. It really isn't. A lot of people fall even in their 20 to 30 age and break their wrists and break arms and things like that. So we do target that audience as well to provide some ways to fall safely, like in sports, for instance, and those types of things. Okay. I kind of went through this where I explained what occupations are and what our focus is in fall prevention, and we're just looking at teaching you some risks and how to be aware of those, okay? So I think this, let's see. All right. Okay, so now I'll just go through how to minimize some of those risk factors. Okay, so it is difficult. Some things we can't always afford to remodel our bathroom. We can't always buy a new car. We can't always fix a shifting cement floor. But we can do little things, and I consider this analogy because quite often my patients don't have the funds or don't have the family support to help them to move around and do everything safely. But I tell them, if you think of like the game Jenga where there's tower, okay, so your risk factors are building up, and as they get higher and higher, you're getting more unsteady. Eventually, it's going to collapse, and that's when you fall. So if we can stop building that tower of risk factors little by little and shrink it, we'll decrease our risk in one way or another. So do you guys have any ideas of some suggestions or things you've done to minimize some of those risk factors we talked about? So physical is one.
I have to keep reminding myself to slow down.
Okay.
A lot.
That's a big one. Any others?
I have to keep reminding myself, when you put your pants on, don't stand on one leg and try.
Yes. Yes.
It never works for me.
No, so that is every single person I work with, I say, do not get dressed standing up. I've walked into rooms where someone had a total hip replacement and the second day they were trying to do this. And it's like, no, don't do that. So yeah, I recommend sit down, let me sit here. We'll pretend this is a bed. Sit down, and if you've got the range of motion in your legs, you can rest it on the bed this way, okay? Some people go this way. This way works too, just if you're like feeling you're gonna fall forward, don't do that. And then if those aren't working, if you're having troubles with that, we can teach you some ways to get dressed using some special equipment. Have you guys seen a reacher, a grabber, picker upper? I've heard all the names. That's a tool that's commonly used for dressing, okay? So some more physical things. I talked about the falls in the bathroom, how common they are. So obviously we can't always modify our bathroom, but we want a bathroom where we have enough room to turn, you know, if we need to. Some bathrooms are so narrow that you can't even turn fully. Coming in and out of the tub, if you have a tub, is really a high risk. So a lot of people tell me, oh, I have one of those mats. I don't like those because they don't always stick completely down, and then water gets trapped, and then the top surface may not be as stable as it needs to be. So we want to make sure that if you're going to use one of those, that there's not going to be water coming in between the bottom and then the top, so then you're really not stable in there. So I always tell my patients, if you're already having a hard time getting in and out of the shower, you might want to look into some grab bars. And then they're like, I want to get those suction ones. Unfortunately, those aren't great because I've seen where they just come off. So if you're really using them a lot to help pull yourself or help lift a leg, I would recommend looking at something a little sturdier. But if you're like just using it for a little bit of balance, those are okay. So that would be an option for those physical things. Other physical things is those throw rugs. They're pretty dangerous. I've had a lot of people fall on those. If you love your throw rug and can't part with it, you can also get some, it's like almost like double-sided tape. Just make sure it's really sturdy and stuck to the ground. Those bath mats too that we have like to step outside of the tub on, those are pretty dangerous. People get their toe caught or they slip on them. So all those things, if you don't want to part with them, make sure they're nice and stable and aren't gonna get caught on your toe, those types of things. Other things, like I mentioned, is in your living room, you want enough space to move. You don't want to be having to turn constantly. Another thing is, people will tell me, oh, I do fine, I just hold on to things when I walk. And I call that furniture surfing, and that's actually an indicator that you probably need to go tell your doctor that you need to see a physical therapist actually to work on some lower extremity strength and maybe look at a cane for a little while. Because if you're reaching out for things, okay, couches, your center of gravity moves, so then if the doorbell rings or the phone rings and you're down here and you turn, it's not the same as if you're right here and you turn this way. Does that make sense? So if you're quickly turning and you're down here, you're more prone to fall, okay? So we kind of went over some physical things you can change, some environmental things. Go ahead.
My cats are always trying to kill me.
Yep.
Oh.
Pets are
Yeah.
a huge fall risk. So that's a tough one because I wouldn't want to part with my pet at all. But just working on training them to not be, running around our feet. And also, I don't know if there's a way to seclude them, like especially if you're somebody that has to get up in the middle of the night for some reason, because that's a high time to fall. So yes, pets, I've had quite a few people trip over their pets, and quite a few trip, a lot of us, we live in a mountainous area, our houses aren't level, so they have stairs to go down, and they trip down the stairs, so that's something to just be aware of and think about if you can seclude them in an area or just really working on training them to not be right by your feet when you're moving different surfaces, like surface levels even. Okay. So those are all our risk factors, just some ideas to reduce the risk there. Some behavioral things. So I have a lot of people that'll say, I have one of those fancy lift chairs that you sit in. I don't like those. And the reason why is you're not using your legs to stand like you normally would. The chair's doing it for you, so then you lose strength, and then when you sit somewhere else, you have a hard time getting up and you can fall. So that really the idea with fall prevention is staying active and using your muscles. All the research indicates that if we all just walked 30 minutes a day briskly, not even weight training, nothing special, just walking, okay? 30 minutes a day, we would all be so much healthier. The rates of diabetes would go down immensely, all those chronic illnesses. So I highly, every person I come across, I'm like, if you can incorporate just 30 minutes of walking a day, and sometimes that's not practical, so I say 10 minutes in the morning, 10 minutes at night, start with 20, and go from there. That really just gets your muscles strengthened, trained, works on your balance reaction, and briskly is just something like this, okay? And that's my brisk. I mean, if your brisk is a little slower, that's okay, but we just want to incorporate using our muscles, keep them strong, and our balance reactions educated so that whenever you're in a situation where you've got to turn quickly, your body is ready for that, okay? So, any questions on those things? Go
With the
ahead.
brisk walking, with my profession, I'm constantly on my feet.
Right.
And I'm not necessarily walking all the time. Do you still encourage having that brisk walk for other reasons? Or
So I would say yes, if you can. I mean, maybe your goal would be just the 20 minutes then, because you want to get your heart rate a little bit higher than when you're doing a task, maybe in like a standing position or a kneeling position, get that cardio up. So it just sends signals to different muscle fibers, different nerves, versus doing a task that maybe isn't sitting, even though you're working a lot, because I'm assuming you're on your feet most of the day. So yes, if you can, and maybe it would be five times a week versus every day or something like that, since you do stay pretty active.
Okay.
Yes. So, okay, so going through some of these risk factors. So if you've got some changes in medications, definitely, I always, when the pharmacist is like, do you have questions? I'm like, no. But then when I get home, I'm like, yes, I did. I'm not sure. They're really resourceful. I didn't realize it until I had a job, actually, that involved one. So what I do is I will look to see how many medications my patients are on and which ones can cause some motor changes or balance issues or confusion, and I educate them about that. So that would be, if you're on a new one, I would definitely ask your doctor and your pharmacist. I love all the doctors, but their mindset's like to help your immediate health concern usually. So you need to talk to multiple people so they can get the full picture of what you need to be able to do. So definitely, this is a big one. I've had a lot of people that like changed from one diabetes med to another, and then they got hypoglycemic, and then they fell, and then they came to the hospital, and it could have been resolved with just simple education of, oh, you should take this one this number of times, or this time of day, or with food, or things like that, okay? Another thing is our vision. We need to check it frequently. Vision is one of those risk factors that highly leads to a fall. So as we get older, we get cataracts and macular degeneration and glaucoma and all those fun things. So we want to make sure that we're staying on top of that, because if we can't see, we're going to fall. So just keep in touch with your doctor, and having a yearly vision exam will help
Do you know, I had cataract surgery, and since then I feel like my balance, or I don't know, I feel like
A
I'm,
little off.
and I'm wondering if it's that,
I think it could contribute, especially how long has it been?
it's been about a year.
A year, okay. So I would, have you mentioned it to your doctor? Okay.
Yeah, my eye doctor?
Yeah.
Mhm.
Did he say anything? No? Okay. I would say that, do you have a primary care doctor?
Yeah.
Oh, okay. I would mention it to him and see, because if you feel like that's a big issue with your balance, I definitely get a referral to like either probably a physical therapist or whichever one he prefers can address it, but definitely can affect your balance. Any kind of vision surgery usually does. So, yep, vision checks, like we said. Balance, everyone's kind of said balance. And that's related to as we get older, we have that fear, we kind of slow down, we're not doing the things as actively as we usually do. So we want to stay on top of that balance, and by using those exercises that Deb provided, the DVDs and all that, that's a great start. We're made to move, we're not made to sit, and the more we can stay active and moving, the better our balance reactions will be. So it doesn't have to be anything extravagant, just something where you're doing more than just your normal day-to-day routine will help with developing those. If you're feeling like your balance is really off, that's something you should mention to your doctor, and they can refer you to a therapist. And it probably would be something short where they set you up on an exercise program, and you just follow through with that on your own. We've talked about a lot getting started on things too quickly. So these behavioral risks are usually the hardest for people because it's accepting that our bodies are changing, we're getting older, we can't move as fast. So this one's the toughest because I'll have people that, are 90, they live alone, and they do everything, but it's not very safe. So trying to accept, all right, what do I have to do? What can I physically do? Have I fallen already doing this? Can I ask for help? Those types of things. Delegating tasks for people is so hard because we don't want to ask for help, but we need to, and people want to help, so please don't be afraid. Anytime, for instance, I go to Costco and I'll see people trying to load up like big salt for the water. What's that called?
Water salt.
Water salt. And they're like, elderly, and I'm like, oh, can I help you? Like, no. And I'm like, I'm gonna help you. It looks a little hard. And people help me too, if I'm getting something heavy. So we can all do better on just letting people help us with that. So just take time to consider what are the things that have been hard, and do you think you will be able to do that, or is it time to ask someone to help you? That's another risk factor we need to work on. So moving on. Sometimes that quicker works. And okay, so we talked about some of these risk factors, and I've got this picture of this woman here, and I just want to ask you guys, what do you guys think she could be doing different? I've had people tell me this. Yeah, right. So
She's standing on a chair, is that what it is?
yep, it's a stool,
Oh,
and she's got one flip-flop on. So flip-flops are not good. If you're already feeling unsteady, get yourself like a nice sandal that you can slide your foot in, and maybe just one strap, or just flip-flops you can roll your ankle, and they're just no good. I've had people after I told her, be like, I'm gonna wear my flip-flops. I'm like, no, you're not. No, you're not. No good. But yep, so since she's got the vacuum right here, so if she falls, she's probably gonna break something, and then probably ribs in addition if she falls on this, or an elbow. And then she's got a robe on, and actually that could get caught on something, and that's not a good idea. Let's see here. She's not wearing good shoes. We talked about that. And then it looks like she's reaching for something kind of heavy, actually. So it's just not a good
How secure is the rug?
Yeah, and the rug too, good point, I forgot about the rug. Yep, the rug isn't good either. So, I will admit, I'm guilty of doing things like this sometimes, and I've tried to get better at not doing it because, you know, I could fall too and get hurt, and we don't need that right now. So, just an example. And then now we'll look in this bedroom. Do you guys see anything that jumps out?
Cords, the rug.
Cords, the rug. So clutter, I didn't mention, clutter is a big, clutter is a big problem. A lot of people, you know, if it's getting harder to clean up and store away and things like that, those things can get in the way and cause a fall. The linens also, I've had people fall making their bed, or a lot of people getting out of bed usually too when they're trying to get to the bathroom. That nightstand, you could catch your foot on that. I would prefer someone to not have that nightstand. So those are all just things to think about. We talked about environmental things. So if stairs are tough, double rails are usually nice, or just a rail in general is nice. We talked a lot about the bathroom. This is probably hard to see, but I did bring, if you're already feeling unsteady in the shower, I don't know about you guys, but I like to just enjoy my shower. So I tell people, just get a chair. Then you can sit, relax, shower, not have to worry about hanging on to your life or slipping. If you need to do anything with your legs, you can usually reach better and safer. You don't need anything too fancy usually if you're staying active, but this is a tub shower combo, what we call it, and it's just got a simple shower chair. This one usually has a back. These are like 20 bucks. The legs are adjustable, okay? And people tend to ask me about surface heights. If you can get anything you sit on to be about knee level, it's going to make it pretty easy for you to get on and off. So like for instance, for me, this is at a good height. This might be too high for Alexis, where she's shorter. But her legs would just dangle. But if it was really low, I mean, I'm going to have to really sit. So something to think about with your chairs at home. And if you get something like this, the toilet as well, making sure it's closer to your knee height will make it easier getting on and off and safer for you. Of course, grab bars. You can also get, have you guys seen a sponge or a loofah on a long handle? Those are really handy, especially if you're like, I'm fine standing in the shower. Going this way puts all your body weight forward. So if you don't got a sturdy rail, and those little tiny decorative ones don't count. You need a nice big sturdy one if you're holding on. That's just not very safe. It's putting all your momentum this way. Usually there's a faucet over here and you can fall face forward. I had a patient who fell, I don't know what she was doing, but she fell on her bottom on the sink, like where the water comes out if you're going to take a bath. And she got a wound and it did not heal. And she was not comfortable in any position, not laying, not standing, it was miserable. And she's still healing from this. And from that, she got an infection and got septic and was in the ICU. And she was completely independent. I mean, she was retired, part-time job, just staying busy, participated in church, and just something like that can happen. So just being
How
aware.
hard are these bars? Do you have to have somebody come and put those in?
Yes, I believe so. If you go to like Lowe's, they'll help you out, figure that out. They're not too hard to install, but you'll probably want a family member to help you with it. I used to know the prices, but I don't remember them anymore. But you can get pretty good deals on them at Lowe's, and the guys at Lowe's are very helpful. It's very nice. Or ladies too, go ahead.
Question,
Sure.
with using the shower chairs, is it better to sit on the chair, turn sideways and to stand up that way, or is it better to stand up using the bars and then step over that high side?
It would be better to the first one. Sit if you can, turn, and get your legs over, because this will probably be dry, right? And then if you've got something to hang on to, then that'll be better. That's in a perfect world where the floor is dry and you've got something to hang on to here. If you don't have anything to hang on to, there's patients that get up on the wet floor and maybe they have a bar here and can step over this way. That one's a little more tailored to what you physically can tolerate with your joints and your movements and your strength. But if possible, you always want to get off, stand up when the surface is not wet, if possible. But that's not feasible sometimes. What I was going to say with those loofahs too that are long handled, those are like $5-10. And sometimes I'll have ladies get two, one for lotion and one for in the shower, just to make that easier and safer for you. Any questions on that or the bathroom?
I got
Sure.
going downstairs sometimes, for a midnight snack, and you try and sneak down without turning the lights on.
Right, I didn't talk about the lights. So lights need to be on if you can. Lighting can cause a lot of vision issues, so then hopefully your vision's great too, but a lot of people will do that kind of, they don't want to disturb their significant other or other family member, but if possible, good lighting is ideal. So you're seeing where you're stepping, especially in the stairs. Sometimes people will tell me, oh, I was just going down the hall and I tripped, and even it was just a straight shot hallway, so lighting is really ideal. And that's one of the things that is probably on that fall checklist to make sure of, is that your halls, and there's just good lighting everywhere in your home so you can see what you're doing. So hopefully they're okay with you sneaking for a snack. Yeah, go ahead.
I've seen these motion controlled night lights that plug in, and when they sense movement from any direction, they'll just turn on.
Those are really nice.
So I've seen them.
Those are
in
really
people's
nice.
homes, and I think that's a great idea.
Yeah, those are really nice. If that's an option for you, they're really nice for hallways and up and downstairs and entryways. They work really well. And those you can also get at Lowe's. Do you have a Home Depot?
Yeah.
All right.
They're
Okay.
not even $10.
Oh, good.
Yeah.
Yeah, those are handy. Thank you. I had this YouTube video, and I don't have internet connection. It just kind of walked through a house and like some ideas for changes to make. And I don't know, do you guys all have an email that you send out an email or?
I can put it on our Grace to Go. Or
Okay,
I
I'll
can
do
put it
that.
on the weekly thing.
I'll do
Some of the people here
Oh, right.
gave me phone numbers, not web-based stuff, so.
No, that's perfect. I'll somehow get that up there. It's really nice. It's a physical therapist and an occupational therapist going in together into like your standard home and just putting out some things that would be something to think about changing to make the home a little safer and decrease the risk of falling.
Did you try to take that and put it in the browser and it didn't work?
I did, yes.
And it didn't work?
Yes. It
Okay.
didn't work, unfortunately. Just a reflection of the risk factors overall. What I really want you guys to take home is, if you have fallen or if you've thought about, I want to prevent this, think about what you've done now and what you could do, simple little things to decrease your fall. A lot of times I feel like we go into our physicians' offices and maybe feel a little overwhelmed by like all the things we need to change or do, or we hear about someone falling and we're like, oh no. So just little things, and if you can pick one physical, one behavioral, and one environmental, that's a good place to start. So an example for environmental is maybe you have had a hard time getting into your shower. Taking time to think about, how can I do this safer? Behavioral, if you've got to, you've lost your balance when something changes, doorbell rings, not getting in a rush, knowing like they'll still be there, and take my time. Just some simple little things you can do so you don't fall. And then lastly, if you guys have any more tips that you want to share that I haven't covered, this handout I have out there, I'll make sure you guys all get that. That one has a lot of really good ideas, practical, simple changes that you can use. But any other thoughts or ideas?
Question,
Sure.
with situations like slick surfaces, Deb was talking about it before the meeting in terms of like winter and everything.
Right.
If you are an independent individual and you're living at home and you have to go out and shovel, I realize you wanna put salt down and everything else, but if you need to take the snow and everything off first, do you have a recommendation?
So definitely
Get
really good
somebody else.
shoes. And then that's when you have to think about, can I do this one safely? Weigh the risk and benefits ratio. Okay, can I do this safely? Or is the risk so high that if I'm gonna fall and break a hip or break a leg or those types of things? And if you feel like you can't, sturdy shoes, and don't make your goal too big. If you feel like you're gonna do half the driveway and you take a break, that's okay. And also thinking about maybe I do need help with this.
Is there a better shovel? Cause I've seen all those different styles and everything else.
Yeah.
And stuff like that.
So I would say
Snow blower.
snowblower, a riding snowblower. So I have seen, so definitely probably a wider one, but that also depends on how much upper body strength you have. And then a wider one, and they're usually like a scoop. I've seen some flat ones, and those are good for chipping ice, I feel, but not so for scooping and pushing.
I didn't know if the bent handled ones, the ones that look like an S curve or
Oh,
better
yeah,
in
you
terms of
get,
lifting.
that's a better lever, and you can use your muscles better with that one. But I recommend you just try it out if you can, and see. But those are a better lever, thinking just about the motion and how your arms work. So those are good. But snow blowers are nice. Moving on. So kind of a summary of the strategies to how to prevent is talk to your physicians and pharmacists about any medicine changes. Get an eye exam regularly. I didn't talk too much about sleep, but try to get enough sleep. In our nation, we do not get enough sleep, and it causes a lot of problems. So that's something to think about, is trying to stay in that routine. Stay active, that 30 minutes a day, going to Zumba, doing your exercise video, and hydrated. I've had a lot of people fall because they were dehydrated and their electrolytes were off. And once electrolytes were better, they were fine. And luckily, they just were bruised. I actually had one lady this week, and she was like, yeah, I just fell, and I didn't know what was happening. And thankfully, she had a spouse there that could call for help. Find alternatives for those risky things, those risk factors we talked about, and then eliminate those fall hazards in your home if you can. So I kind of want to go through what to do if you fall. So some of us don't have the blessing to have someone around, so I'll go through that too. So if you fall, try very, very hard. Your fight or flight's going to kick in, and you're going to try to get up right away. And if you can remember, try not to. Try to just sit still and take some really deep breaths, because I've had people who fell and broke a leg or a hip, and it was just a simple fracture, and then their bone displaced, and that makes it very complicated. Or the bone is called comminuted, which means it shattered, and that's a more complicated procedure and recovery. So if you fall, I want you to try to take some deep breaths and think about, am I hurt? Really just do a body scan. Is something hurting? Do I think I can try to get up? Okay. And I'm kind of going through if you're alone, okay, first off. So remain on the ground for a little bit, take some deep breaths, do that scan, and then figure out if you're hurt or not. And then if you feel like you aren't hurt, I will show you, but you're going to roll on your side, and then I think it'll be better if I just show you. So I have this mat, and hopefully there'd be a mat, but there probably won't be if you fall. So all the videos show people like this, but people don't fall like this. They're usually something like this, okay? So I'm going to take some deep breaths and really think about if I'm hurt, okay? And then I might slowly move to my side. I'm already on this side, so I'm going to come to my side, try to push up with my arm right here, okay? And then do you see how I'm pushing using my arm and my elbow to come up this way? Okay? So now I'm here, and then usually you can come up to your knees, and you're gonna crawl to a stable surface if you can, okay? And then usually it's your dominant leg, but at that point it'll be whichever leg you can. You'll come up to one leg and then push yourself up. So that's one option, okay? Another option is if you can't quite get on all fours, that's called a quadruped head. It's just a fancy name for baby crawling position. You can kind of crawl and push yourself this way, okay? Get to a stable surface. If you can get a leg up, that'll be helpful, and kind of push yourself this way, okay? And this way. I did that with one hand. If that's not possible, you can use both to kind of help push yourself. Key though is stable surface. Recliners, a no. You don't want to be rocking. Something that's not going to slide on you. Okay, that's on your own. After you fall, you need to tell your doctor. And if your doctor, they might not know that you can get referred to a OT or a PT. It's just short for occupational physical therapy. But remind them, because if you've fallen once, the chances of you falling again are quite high. And you need to have someone come in to your home or just meet with you to either figure out if this was a strength problem, a balance problem, a vision problem, or if there's just a lot of hazards. Because that time we were lucky, you might have just had some bruising, but next time you could get a fracture, and that really can lead to mortality, and we don't want that. We want you to stay healthy and active, so.
You know, a lot of us, we don't have the upper body strength to, help ourselves.
Right.
To get up.
Right.
And I don't keep my cell phone with me
Right.
at all times. So if I can't get up,
Right.
no cell phone, and nobody's home, I'm gonna be laying there.
That would be not a good situation, and that's honestly most of the scenarios. So that's at a time where you need to think about maybe finding a way to carry your cell phone or one of those medical alert bracelets. And now they're kind of sleek. Before they were like this giant like medical alert, like very flashy, but now there's little tiny necklaces, little bracelets, and a lot of people can't get up, like you said, and I'll kind of go through that next of what you can do. So, if at all possible, the first thing you want to do if you fall and you cannot get up and you're all alone is thinking about getting one of those medical alert bracelets or cell phones. It's, I mean, you can shout, but I've had, unfortunately, ladies lay out on the street all night long, and then they have hypothermia, and go ahead.
I just want to say that I had a patient one time out of Power County, and the wind just came up and knocked her screen door flew and knocked her right off the side. And so she had her alert bracelet, her alert, around her neck. She pressed it, and her family was inside. They didn't know that she'd fallen and couldn't get up. She was hurt on the front steps until the ambulance pulled up. No, really, she said, I'm so thankful I had that, because she said, they couldn't hear me. It's windy, we got a storm, and the screen door throws me off the side of the front stoop. So, I mean, they're really nice.
That's happened too, where maybe even a spouse went down for laundry, and then the other person was watching TV, and they were down there for hours, hurt, and didn't hear them because their hearing aids weren't in, and things like that. And it's just, any scenario you wouldn't think could happen, it happens. So if you're alone, I highly recommend that, because if you don't, and you can't carry a cell phone, because sometimes it's not practical to carry a cell phone, and we just don't want to. You are putting yourself at a really high risk of, if you fall, increasing your risk of passing away, because you're gonna not eat or be able to go to the bathroom. You can get what's called rhabdomyolysis, where your muscle tissues start to break down, and by the time someone finds you, you are 50 times more debilitated versus if you just had a long bone fracture. And the rehab is triple the time. So really think about, if you're alone, looking into some ways to get some help. And if you guys have some questions about that, I can find some resources for you to get access to those types of things. I've had other patients that were like super against the medical alert bracelets, and they just have a family member or friend who frequently would check in or call or those types of things. So setting up something like that is an option as well. But do something, because don't lay on the floor all night. That just makes things so much worse. So I'm going to show too, if you fall or you know someone that fell and you want to help them get up, how you can do that. It's very similar to how you get yourself up. But I asked Alexis to come so I can show you guys that. So hopefully she would have her cell phone, right? And this is perfect world. She fell on the ground. Most people do not fall perfect world and just on the ground. It's usually in the hallway or in the bathroom. So she fell, and I'm coming. And I made sure she's asked her how much pain do you have, and we want to make sure that she just physically can't get up versus had a severe injury, because we don't want to make that injury worse. Then we need to call the paramedics, okay? So I would come and I would help her straighten out her legs, okay? Bring your legs up this way, okay? And then hopefully they're comfortable with you touching them, but you're gonna help them roll to their side. So you're gonna help them roll this way and go very slow. You want to make sure that if there's any sudden movement and she is in screaming amount of pain, we're gonna stop. We're gonna stop and call the paramedics. And if you have any hesitation, just call paramedics. But if you're like, I just can't get up, like I'm not strong enough, then you can try. So I'm gonna help her go this way, and then I'm gonna help her come up to all fours or to the side, okay? And then I'm gonna help her, if she can, crawl, come up this way, okay? And then she can bring up one of her legs and then push herself up. And I'm pushing at your hips. So you're really grabbing the hips the whole time and helping them lift and push. You can also push under the arm to help lift up. Don't do this. Don't do this. Don't do that. I've had family members, so one of my grandmothers had really progressive Alzheimer's. And my mom would always be like, come on, go up. And I'm like, don't do that. So I'd be like, help her this way. You have to kind of grab their hips. That's where most of our body weight is. So that's kind of a short, I have those videos that I can attach to the online resource, and that kind of goes play by play. So that's that. Any questions on that?
When I fell a couple weeks ago, I couldn't get up,
Mm-hmm.
and there was no chair around for sure. Outside, I had a heel about like that, which I shouldn't have been wearing,
Oh no.
and they've gone garbage.
Okay.
And I
Okay.
rolled, I finally rolled.
Okay.
I was completely short of it,
Mm-hmm.
and I had some vines there, so I held on to the vines and sort of pulled myself to the house, and then I walked up the house. Oh my, if
jeez.
anybody had a movie camera, they'd really got a crazy shots.
Were you were okay though?
Yeah, my
Okay.
pride was really hurt, but I
It's
did fall
hard.
real hard. I'm like, I thought maybe I hurt my ribs or something, but the lady told me it was probably the muscles.
Okay. Yeah.
But it was
I'm so
really bad.
sorry. Yeah, that can be. It's hard.
You know, I was telling this lady out here, I was walking out of Walmart the day after Christmas, and I don't know if I was just tired or what, but you know, they have that high step
Mhm.
that's painted, and I guess I just didn't think about the step.
Mhm.
And I fell, and I landed on my forehead, and I was like this, and two ladies, I don't even know, I mean, you said you couldn't get up, because you don't want anybody to see it, because you're so embarrassed.
Yes.
Two ladies came and helped me up, but,
Mhm.
you know, I
Yeah.
guess
Thank
I
goodness
just
you
had a
weren't hurt.
bruised ego because my whole face turned black.
It is, and it just
It just happens in a second, you don't
it
even
does.
realize.
It happens. So my dad, he's like 57, and he's fallen a whole bunch. So he fell down the stairs one time because one of our dogs came under him, and he was holding one, and he didn't want to crush her, so he turned and fell on his ribs. And, I'd say, to me, my perception of age has changed. 90 and below is super young to me, because I've met 90-year-olds that do everything. So, try not to let it bruise you, because life happens, and it's just a progression of our age where our vision changes and our balance changes, and some of those things we can't control. So just focus on what you can do, and just push through with that so that you don't get further injured. So I'm glad you were okay. And it's perfectly okay to ask for help. One thing I didn't mention is if you do fall and you can't get help and you don't have a medical alert, you need to try the shouting. And if there's a blanket or anything around you, you can reach for to try to keep yourself warm. Try to reach for that. Try to relax. Try not to be super tense. And just do your best you can to shout for some help. So don't put yourself in that position. Really set something up where if you do fall and you don't have any way to communicate, that you have someone checking in on you, or someone who calls you every day and knows that if you don't answer, something's wrong, and they need to check on you. So, went over the practice, and then that's the other video, okay? Last thing we talked about, you need to tell your doctor. Also, right after you get up, write down what happened. Write down what you were doing, what you were carrying, what you think caused the fall, because that'll really be helpful if you do go to a therapist to figure out, was it just my shoes? Was it that my legs are weaker? Was it that my vision's wrong? Was it that I was dizzy? Have I started a new medication? Or did I just pass out? Because then that gives your healthcare provider some clues on what to look for to help you. I've had a lot of patients who fell and realized they had a heart arrhythmia, and they didn't even know it. And the fall is what led to it. Or they had a different heart rhythm. One that's common is atrial fib, which is just pretty heavily elevated heart rate. And they didn't even know it. And the fall actually helped them figure that out so that they could be on some medication to help that. Big thing. Once you fall, you are terrified of falling again. Absolutely terrified. And you kind of close in like this. And that is not good. That actually puts you at a higher risk of falling. Because if you're trying to do anything, you're very careful. You're not really using your body, and your center of gravity is off this way too. So that's why it's also important to tell your doctor, so that if you're having that fear, you can get started with some kind of a therapist to work on getting your strength and confidence back with doing your day-to-day activities.
I have a question.
Sure.
Going back to, especially like with the winter and everything.
Right.
We're going to parking lots. I mean, she mentioned Walmart at Christmas and everything else
Right.
like that. They have those things that you can put on your shoes.
Mm-hmm.
Do you recommend any over any others?
Which things over your shoes?
They're like traction.
Oh,
Pleats, yeah.
cleats, yeah. I don't think so. I think that'll come down to a personal preference. Just a good shoe that you usually don't roll your ankle or slip on, that has a good sole with traction would be good. And a lot for extra time. Don't be in a hurry. Take your time to walk in and out. That would be my best suggestion. And the traction shoes, I've had quite a few people use those that have to be outside a lot during the winter. So I think it just was personal preference is really, go ahead.
This year, the Grace parking lot
Oh, boy.
was really icy.
It was,
And it was horrible.
yep. Yeah, I'm not sure how to fix that one, but they're taking your time. And also just asking for help. And then maybe if we're finding quite a few people are struggling with that, we can do some kind of thing where a few of us help others in getting in and out of their cars safely. I'm sure that would be easily accommodated.
Yeah, the best way to do that was just to have somebody drive you up and drop you off. That was the only way to get away
That was
from
the
that.
only way.
Yeah.
Where we're kind of slanted, I don't know if the sun hits as much as it could if we weren't slanted. So, I think I may have skipped one. Let's The fear. So I just want to highlight this because if you fall and you do get hurt and you come see me in the hospital, I'm going to do my best to help you. And part of it you can't help, but we got to work on getting past that fear because it's so hard to recover and rehabilitate after that. If your fear is so high, it just doesn't usually lead to a good outcome. So if you fall and you thankfully don't get hurt, we need to work on keeping your strength and endurance up and reducing that fear. Just keep you healthy and in your home. And then overall, just falls can be prevented to an extent, and those risks can be decreased. And you guys are all the leaders of that fall prevention plan. So go talk with your family. Think about in your home what you have and what you don't have, or what's hard, or reflect on those falls. And use the resources we gave you guys to make some simple changes. And just by being here is a great start. And if you guys have any other questions or concerns, you can always catch me and we can talk about it. This is just some of the, I got this presentation from our online professional association and I made some adjustments, so just reflecting on them. Just some resources. Deb has some more actually. There's actually a fall prevention class here in Pocatello,
Yeah.
right? And I think she'll touch on that.
Yeah. I'll talk about
And then I did call Gold's Gym, and they do have like special memberships for people who are over 60, I believe, but they wouldn't give me the pricing. So I was like, okay. And then online, there's a Senior National Institute of Health website that if you ever want to sit down, and maybe you don't use the internet very much, we can sit down together and look at those resources too that are available to you. And that is it. Thank you.
You know, I belong to Gold's Gym, well, I did it for a year,
Right.
and you can go, I think the membership is like $20.
Yeah,
if
it's not
you
very much.
go between 8 and 4.
Okay, very
And I don't know
nice.
if it's seniors or just anybody.
Okay, yeah, they would, over the phone, be like, you have to come in. Okay, sorry. Go ahead.
Pocatello Recreation also has, used to be the Y,
Yes.
and that's the one I go to, and 2 days a week we have what they call chairs, which is for the equilibrium.
That is excellent.
And when I was hurt last fall when I fell, I didn't do that for a while, and boy, I just about came in with it.
Mm-hmm.
Yeah.
That's an excellent
The
resource.
swimming, and I think if you have certain insurance, they do me, all I have to pay from here is $50, and they got yoga, they got swim, and they got
Great. That's an
exercise
excellent
machines.
resource. Excellent, yes. And then any other questions or resources you guys want to share amongst yourselves?
A lot of times, you know, all this is excellent, but I don't use my common sense sometimes, and I try
Most of us don't.
and one of them was, we have a fire pit, you know, brick and whatnot, and hostas. I was reading the hostas, so I'm kneeling on the bricks,
Okay.
okay? They fell, and I ended up falling backwards, and I landed
Oh,
with my
no.
broken hip side onto a log. And I laid there. Of course, I was by myself.
Right.
And I thought, well, what did I do now?
Mhm.
You know, I didn't get hurt, thank goodness, but it's stupidity.
Mhm. That's
Some
those.
trustees like that.
You know, I thought I was the only one.
No, you're not the only one at all.
I noticed my swimming suit out on the clothesline, and I went flying out, stuck my toe over that entryway, went down
Oh,
3
no.
concrete steps, ended on concrete, knocked myself out, broke 2 bones in my face, in the wrist, big gash in the leg, face was swollen like this forever. I said, is this gonna be forever? And they said, well, it could be, you don't know.
Yeah.
Big gash in the eye, oh my.
Oh dear.
Yeah.
Yeah.
For a while, I didn't do anything, I just laid and moaned.
Yeah.
Do you think
Hard.
after you fall, is it real common? Because I'm just paranoid now about falling. I'm
Mhm.
just scared to death, you know? And I don't know, do you have to get help to get over that? Or just maybe realizing
So
that's just
I would say if you're withholding from doing activities you usually would do, I would ask your doctor to see a therapist to get your confidence and your strength back. If you're withholding from doing things you normally would do because you're so scared of falling, I would recommend that for you. Or maybe start some of the classes that were suggested would be a good idea too. I think that it is not easy to get over that by yourself. You kind of have to be pushed a little bit by someone that's like, I know you can do this, you know, you've done all these things, those types of things, so.
You can assist
And-
you safely.
Yes.
Yeah, that's the thing.
Yep. And then with you guys said, those are, 99% of the injuries are, I was just doing something and didn't realize this or didn't expect this to happen, and those are just part of that behavioral risk where we just gotta take a step back, and if we know we've fallen, looking to see, you know, maybe I'll go to this side or not lean on the bricks, or if there's a different way to do that, but we get in a hurry or not in a hurry, we just do things like we usually do, and it just happens. So it's, like I said, it's risk factors we're trying to decrease, so it's not 100% foolproof, but it helps to just take a minute to think about how we're doing our activities, if that helps. So, any other questions or concerns, or?
Are there any technology helps that are coming off the market that you can talk about?
Like,
I don't know.
okay.
Maybe in a safer place. Maybe the bathroom was safer.
So, like equipment, do you mean? Okay, so I mean, the first thing that came to mind, which I don't know why, but, so a lot of people fall when they're doing hygiene after going to the bathroom. So bidets help. Bidets aren't cheap. So that would be a technology I would think of. I know with like some of the smart homes now, where you like talk to something in your room, that is connected to internet, and you could probably alert someone if you fell that way. I know a lot of us, iPhones are popular, and you have Siri on there, and you can change some of the system preferences on there where you just voice command it. Right now, if you have a standard iPhone, you have to push it and then talk to the Siri gal. But there's some options there for people who are visually impaired that can be used for someone else that's hands-free, where you could say, like, call whoever, and it would call. So that's what comes to mind. But I can look into it and get back to you.
I'm just curious.
So, yeah, I'm sure it'll get even more advanced eventually. So,
I know my daughter, she's got some program on her phone, and her lights were, you know, some of her lights, she just opens up her iPhone and turns them on.
oh, yep.
She actually got it because she wanted to turn off her children's lights and make sure they were off when they left the home.
Right.
So, I mean, there are things like that. You know, you could
Yep.
get lights on before you get up to go to the bathroom. That would help me.
Right, that is handy, right. Well, I really appreciate you guys coming and just taking time on your Saturday to learn from me a little bit. Hopefully there's something you can take home from all that, and let me know if you've got questions.